Hello, 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 hello. You are welcome to another time with the celebrity doctor. Well, we thank God so much that you are able to join us today for this wonderful broadcast. In fact, today we are going to treat a very interesting topic, abnormal discharges from the vagina and the penis. Abnormal discharges from the vagina and the penis. And today our celebrity doctor is going to take us through this wonderful topic, and we are going to understand what these discharges are and what to look out for if you wake up and you're having some discharges from your penis or from your vagina. Is every discharges normal, or should you be worried about every and any discharges that come out of your penis or vagina? I'll be asking some questions myself because Charlie, boys, your questions answer. So I say your questions. I see a bisa into a bit bisa. So stay with me, stay tuned with me as we begin this journey to decipher abnormal discharges. Without much ado, I want to bring in our celebrity doctor and then ask her a few questions and then hand over the mic to her, and she will take over from here. So, our celebrity doctor.
Hi, Mr. Kelton.
Yeah. How are you doing today?
I'm very, very good. I'm doing very
wow.
very
Wow.
Very well.
You are really looking so beautiful.
Thank you.
Today.
Thank you.
We thank you so much for joining us today.
Thank you.
In fact, we are so excited to have you with us. Today is one of the times that we really want our questions answers.
Yes,
and today we are going to treat a topic, an very interesting topic entitled discharges from
abnormal
penis.
discharges from the penis and the vagina.
Okay, yes. So what are they?
Okay, thank you so much, and then a very good evening to our listeners and viewers all over. Today is post-Valentine. I hope you are enjoying yourself. So back to the question, abnormal discharges from the vagina and the penis. Before I answer that, I would just want to say that these are discharges from the vagina that are not the usual type of discharges. So every man or woman or male or female, we have normal discharges that comes from the vagina of the penis. So when it comes to the men, the normal discharge, like the seminal fluid or the semen that comes out either pre or after or during ejaculation.
Wait. I have a question here. You know, sometimes you may have a dream, yes. And for example, you have a dream that maybe somebody is rubbing their body around you, and then or you're having sex with someone, and all of a sudden you wake up. As soon as you wake up, pia. Is that normal?
Those are, so far as it comes as an ejaculation, it's a normal discharge. We are dwelling in discharges that comes from the male penis that are normal. So from ejaculation, that is a semen. It's a normal fluid that comes from the male.
Okay, so the pia no is normal.
Yes, that is if it
normal.
Comes as an ejaculation.
Oh, okay. Hallelujah. Let's continue.
Okay. So we have also from the female, and then the female they have discharges as in from menses from the menstrual cycle, and then there is this normal fluid that comes during ovulation. Okay, it is slimy and thick. Those are normal vaginal discharges. So when we talk of abnormal vaginal discharges or from the penis, any discharges aside those ones that happens in normal physiological processes, that is what we refer to as abnormal discharges.
Okay. That's what we refer to as what? Abnormal discharges.
Yes.
Okay, so what are the causes of these abnormal discharges?
Okay, so I don't know whether to start from your gender or my gender. Maybe let me start from your gender.
Yes.
So
And the male gender.
yes. So for the purpose of clarity and understanding, I would like to segment it for both male and female so that we'll be able to appreciate it very better. So when it comes to the causes for the men, I'm starting with the male gender. When it comes to the causes for the men, the most common cause is is gonorrhea. Okay.
Okay.
Caused by yes, Neisseria gonorrhea. We have other organisms that can cause us, like the chlamydia trachomatis, like the mycoplasma, but the most common one for the male is gonorrhea. So when it comes to discharges or that comes from the male, we can have it as grouped into the one that are caused by gonorrhea. We call it gonococcus, and then the ones that is non-gonococcus. But the most common cause of it for the men is gonorrhea. Okay, and then when it comes to the women, also the same also applies to the women. The women also can have from gonorrhea, and then also they can also have infection coming from vaginalis, coming from chlamydia, trachomatis, mycoplasma, all of that. Candida albicans comes especially from the women, and that is the Candida albicans is what we call whites. Okay, but it is not all of these discharges that comes from the female or that are white or that is stemmed the white that we have. Most of these ones are caused by serious infections, and then such as the gonorrhea, the chlamydia, and then all that you can have with it.
Okay, so what discharges that when I see I should get worried?
Okay, so I want to give a graphic, something to show to you.
But before our celebrity doctor show us these pictures, I just want you to know that these pictures are sensitive, disturbing, and graphic. And so at this point, if you are not really comfortable looking at these pictures, you can quickly close your eyes or switch off the broadcast, because we are going to show you graphical pictures, very graphic, very sensitive. And so take note of it. Thank you. Okay.
Yes. So the discharges that can come, it can look in a form like this, if you can see. So when it comes to the male,
okay. So
yes. So when it comes to the male reproductive, you can see the male reproductive. That is a penis, the tip of it, and then you can see the discharges coming out. Okay. So the discharges will come out starting like a white discharge. Before you realize it lose cream, it can lose green, and it is very, 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 very offensive. Then that of the female as well. That of the female too, you can see the discharges that are coming from the female vagina. And these discharges, sometimes it is also whitish. It can look like cheese or a milk that has spoiled, curdled milk that has spoiled. Okay, and these are the types of discharges. So anytime you are having a discharge from your penis that is not of the usual one that you have during ejaculation, and it is having all the characteristics I have mentioned, then you must know that you are dealing with an infection, especially if it is after an sexual activity. You are dealing with an STI, commonly gonorrhea. Then also as a female, if you are having discharges, whitish discharges, if you are having the discharge, sometimes it can be creamy, sometimes it can be greenish, sometimes very, very, very offensive. If you are having any of such discharge, sometimes it will look like cheese, spoiled milk. Please know that you are also dealing with an STI of a sort. So you need to take precautions of that.
Wow. We have learned a lot. Frankly, if it isn't for today, I wouldn't know. Some of these are things that I need to take note of, and you need to take note of. So, Doc, apart from these discharges, as you have explained, how would I know? Does it do we have pain with it, or is just normal discharge? Like I wear my boxers like a
so
man.
you want to find out the signs and symptoms?
Yes, the signs and symptoms.
If somebody has a gonorrhea, what are the things that the person can experience? So again, I'm going to take it from the men and then I'll come to the female. So when it comes to the men, one of the common symptoms that they complain about, apart from the discharge, is pain during urination. Okay. Yes. So they'll complain of
during
pain.
Urination.
Yes, during urination. The reason being that the same urethral tract or the same tract that the infection occurs is the same tract that urine passes. So when the infection occurs and all the inflammatory processes, it has become sore as they pass urine, because the urine is highly acidic, they begin to feel a lot of pain. So one of the symptoms for the men, apart from the discharge, is that there is pain during urination. There is pain during urination. Then also when it comes to the female, okay, the female, apart from the discharge, they may have itching of the vagina and the vulva area, and then also it may be accompanied with lower abdominal pain. There is one thing that you must note is that most women do not know they have an STI, especially when it comes to gonorrhea. Most women do not know because the urethra where they urinate from is different from the vaginal orifice. So it is difficult to detect it early in the female. So it is the men that come early with the symptoms that they present, and they in turn tell the partner that I had an affair with you and I think you have a gonorrhea because of these differences that happen in terms of anatomical structures of the reproductive system.
So, before you continue, I want to ask, this means that we should not do single treatment, right? Where you alone go to the doctor to be treated, and that's the end of the story.
Yes,
right?
We'll come to that when we are handling the treatments.
Okay, continue.
Yes. So that is basically the signs and symptoms that you can have.
Okay. Now, from what you said, I understand that the females may not really present a system symptoms earlier on, but the men will present symptoms very early, right?
Exactly.
Okay, so how do you treat it? What are the solutions? How do I get out of it? If I have an infection, what do I do?
So that is why SHAP Clinic, we are here for you. We help in management, comprehensive management of your STIs, and we always give you the best.
Okay, so Doc, and before you continue, viewers, on your screen right now, we have the site of SHAP Clinic right now. So it is shubclinic.com. Kindly go there. You can book a free consultation with Doc, your celebratory doctor. It's a private and discreet conversation, okay? No one will hear you and the doctor alone. After your discussion over the phone, she would give you a comprehensive treatment that is unique to you, and you don't need to be shy because nobody will see your face, okay? So right now, go to the site right now, even as doctor is speaking right now, go there, book an appointment, and also you can also subscribe to our channels. So the YouTube channel, the Facebook, the TikTok, and the Instagram. Please follow us. It's very important. Follow us because there'll be promos and there'll be free treatment. There'll be free clinics. Follow us. Subscribe, like, so that you can hear, you get notified whenever we go online. So Doc, let's continue.
Okay.
We're talking about SHAP Clinic.
Yes. So as I was saying, that is why SHAP Clinic, we are here for you. I may not go into details in the specific medications that we give, but for general management, what happens is that when you come to us, to our clinic, we have comprehensive management of your STIs, and we can develop or do two approaches based on your presentation. But at SHAP Clinic, we believe in syndromic management. If there is a need be that we need to do further test investigations, we'll lead you to do that. Because as I said earlier, apart from there are interplays, when by the time an individual comes with a vagina or a penile, a discharge from the penis, you realize that it is an interplay of a lot of other organisms in place. So we make sure that our treatment targets all of that. So when you come, there is a detailed history taking. We take a history about your biodata. We take your sexual history. We take your drug history if you are on any medications before. We take your medical history if you have any chronic condition that you're already on treatment. We take a comprehensive detail of yourself so that we'll be able to give you the best that we can. And then also, as part of our treatment goals, like you said earlier on, we also hammer on what you call partner notification and treatment. It is very, very important when it comes to treatment of STIs, especially gonorrhea for us. Why? Because if your partner or partners are not treated, you will be treated, but you go back and sleep with them and pick up the infection again. So we always entreat that you bring your partner or your partners for treatment. And then also, we also, as part of the counseling, we emphasize that as a treatment is ongoing, you abstain from sex. And if you have to have sex at all costs, and then it should be a protected sexual activity. So that is the broad perspective of treatment we have for you at SHAP. And then when it comes, there are a range of medications. We'll make sure that we give you the appropriate and the concise medications that will best fit your presentation. And it is very, very comprehensive and a well-packaged one. You'll be impressed to come and have a treatment with us.
Wow. I'm excited. I'm excited for today's broadcast because for one, I've understood discharges. I've understood that not all discharges are discharges we should be worried about. Some we should be very worried about. Some too are normal. It's not all smelly discharge. Wait, before we continue, are all smelly discharges I should be concerned about? Or just because it smells doesn't mean it is dangerous? Yeah.
So all discharges, the normal discharges that you have from the penis or the vagina is odorless. Even if it is a vagina, there's a peculiar smell that makes it normal. So any other smell that is offensive, it's not normal. You have to investigate, especially if it is coming after an unprotected sexual activity. Okay, if you are having a smelly discharge coming after an unprotected sexual activity, you should be concerned that you are dealing with an STI, and then you should take the necessary steps.
Okay, Doc, somebody told me that as a human being, once in a while, you should taste your discharges. For example, if you're a man, you should taste your sperms and see how it tastes like. And the woman, the same thing. Is it something?
Please, I can't attest. I can attest to that.
Hey, boys! Yes. Boys, Haji! And think about your boys. Careful to now, and then I'm gonna see and tasting. You say you're wrong.
The most important thing is that just be sensitive to your body. Okay, know your body and know your body parts. Okay, I think what they wanted to say, not necessarily that you should taste, but you should be familiar with your body. You should be familiar with your normal vaginal odor. Okay, you should be familiar with your normal self, so that if there's anything going abnormal, you'll be able to detect it. Do you understand? I think that is why they are giving that advice, because it is very important. If you do not know how normally your vaginal, the fluid that comes from your vagina smells, if there is any abnormality, you will not be able to recognize this early. So I think that advice, in to a large extent, is just to give all of us to be conscious of our body and know our body and ourselves, so that if there is anything going haywire, we'll be able to intervene as early as possible.
Okay, so viewers, we have come to the end of today's broadcast, but there is one thing I want, and one question I want our doctor to answer, and then maybe we'll go on to other questions she has. If you have a peculiar question that you want us to address, you can always send us a message in the chat, and I'll ask doctor, and doctor would address it. Okay, so one of the questions I'm asking is this, doctor. A question coming through is this: can you get gonorrhea in your throat? So, for example, somebody goes to give somebody a blowjob, and unfortunately, that person has gonorrhea.
Mr. Kilotin, you have answered the question. You have already answered the question. So, gonorrhea discharges. You can get it in the throat. If somebody has a gonorrhea and there are discharges from the penis, and you happened to give a blowjob, which is just a local term given for oral sex, and you have an oral sex, yes, and the discharges are filled in your mouth. Sometimes the sperm, women swallow it. I have had a lot of cases where the women come and say they have had a blowjob and then they have swallowed it. I even had a typical case. The person was scared if she would get pregnant. I was like, oh, you could have, apart from pregnancy, it's not even an issue, because if you swallow, it's not scientifically proven, but you are rather prone to other STIs. And true, she had herpes in the mouth. She had pain in the throat. When you looked at the back of the throat, you realize that there are exudates which are not normal from other throat infections, and then realize that it was a sexually transmitted infection from a blowjob. So yes, if you have oral sex, and the individual has any of the STIs, gonorrhea, you will get it. Okay, so how do I prevent these infections? How do I prevent these discharges? Yes.
What do I do to prevent these discharges? Yeah. And guys, ladies, this is the part I want you to listen. Prevention is better than cure, as they say. Prevention is better than cures. Yes. So please, let's pay attention.
Okay, so before we come to the prevention, I want to just highlight on the complications of this, okay? A lot of us engage in unsafe sexual practices without looking at the complications or the consequences that may arise with it. So when it comes to complications, if you have gonorrhea and it's not treated, for, let me say for the men and I'll say for the women. So for the men, you can have infection or inflammation of your testes and structure of your male reproductive, that we call it epididymis. So we can just name it epididymocarditis, okay? It means that infection or inflammation of your testes, and that can in effect affect your fertility. So another complication for the men is infertility. Then there's one thing, you see, the urethra, of which the sperm comes out, the infection occurs, it's just like a tube. So when it happens, due to all the inflammatory processes, your body trying to fight it and everything, it may leave scars within this urethra. So you may have what to call a urethral stricture. In such a stricture, it means that the urethra, there is a narrowing. So the smooth patency that is supposed to have, it will not be able to have it. Okay, and that is what happens if it's not treated early over time. So you realize that most of the men will say that now, after I urinate, it's divides into two. It's mostly because of strictures. And if this stricture is not handled early enough, it will continue more narrowing, and the individual will not be able to urinate properly. So the man will come, you realize that he's straining to urinate. You realize that when he's not, if he urinates, he feels like I still have a backlog. And if a time comes, you are not able to urinate, you realize that there will be piled up of urine in your bladder, and the stasis or the build-up of this urine will be a good medium for infection to thrive. Then the second thing is that if the bladder becomes full, it will be looking for areas to spill the urine into, and one of the areas it will go is backflow to your kidneys, and you have stasis or build-up of urine in your kidneys that is not supposed to be there, and that is what leads to what we call hydronephrosis. Hydro just means that fluid, and then nephrosis is kidney. So fluid in your kidney and prolonged stay of that will damage your kidneys, and that is why most of the young men are coming with kidney failure because of untreated gonorrhea or poorly treated gonorrhea that they have, and that has resulted in strictures giving this. And then when it comes to the female, yes, the female also have their parts. They also have the infertility. They also have what to call it can lead to PIDs. It can even lead to ectopic pregnancies. Okay, ectopic pregnancies. So these are a few of the complications that we have. So it is very important to look at a gonorrhea if you have it. So when it comes to the prevention, we have guidelines for the prevention. The first one, you all know the ABC. Now we have added a D. So the A is abstinence. You abstain from sex. And then the B is to be mutually faithful to your partner. The C is consistent and correctly use of condom. Please, it is very important. I remembered condom use. They asked a gentleman that when you go, they said they came with a wife and they said, we don't want to get pregnant. They said, oh, when you go and put the condom on the organ. Unfortunately, he's an organist in the church. So when he went to put the condom on the piano, supposedly organ, and then the wife got pregnant. He came back and he said, you asked me to put it on the organ, please. Correct and consistent use of condom is very, very important. And then the condom is supposed to be used at every round. Even if you have the stamina, you are going for 10 rounds, please 10 condoms. It is not a reusable. And then the D is what we call delay of early sex, because we have realized that early sex is implicated in a lot of things. So if you delay early sex, is also part of the prevention measures that we have.
Okay, thank you very much, Doc. You have really shared some interesting topics with us. So boys, especially the boys, Charlie guys, if you get gonorrhea, don't stay with it. Don't go to the drugstore and buy some drugs. Please, I beg you. This is free consultation. Doctor can consult you and take care of you for free. He's not charging anything. Kindly go to the SR clinic right now. Book an appointment right now and let them treat you. Please, let them treat you, because this is very serious. I really don't know what to say again, because at the end of the day, if you are not careful, you will get kidney problems. You get all manners of stuff.
And even HIV.
And even HIV.
Yes, because the STIs, we call them John the Baptist to HIV. John the Baptist came to prepare the way for HIV. So if you have STIs, especially gonorrhea, because it's an infection, you scratch, especially the women, they'll scratch, they'll sit in hot water, they'll use aboniki, they'll use Vitago, they'll use all manner of things. You create source and medium. Okay, so anyone you have a contact that have HIV, you have increased the chance of you getting HIV. So it is very, 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 very important. When you have any of these symptoms, please do not sit at home. Do not feel shy. Contact us. As our host has said, sapclinic.com, we are here to serve you better. So just book a call, a consultation. Let's get talking.
Well, thank you so much, Dr. Sussie, that you have been available for us and you have taken good care of us. This is a great opportunity. I want to tell you again, Charlie, boys, girls, let's go to the site. Let's book a free consultation with doctor. And let's talk with doctor. And also, if you have, you're at school, you're at church, you want to invite doctor over to come and give a talk, I just want to say that go to the site, all right, book a consultation, and when doctor consults you, you can let doctor know that, oh, you did not come for sickness, but rather you want to invite doctor to attend a program in your school to give a talk on sexual health. Doctor will do that. So, Dr. Sussie, thank you so much.
Thank you.
Give it up for Dr. Sussie. Let's give it up for Dr. Sussie. She has done so well. 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 Thank you so much, Dr. Sussie. My name is Otin, as usual, and I've been the host of Sex in the City, the only show that talks about sex. Let's give it up. Thank you so much for being with us. This is we signing out and telling you, see you again next week, Saturday. Bye-bye.